Hello folks, how are you doing? So today's topic is a really interesting topic. We are looking at medical emergencies that does not look like emergencies. What that means is the symptoms will make you believe that it's not an emergency, and that is deadly and dangerous. Okay, so we'll look at them today and make sure you make the best out of it because I took efforts to prepare this. Also, if you find it suitable, make sure you discuss it with family, all the members, especially your parents and everyone, including adults, healthy or not, because someone should tell that look, this is an emergency, don't take it lightly. So discussing it at home helps someone to point it out. Okay, so let's move on. So there are obvious emergency symptoms that everybody is aware of, like a stab attack where the person is completely in a pool of blood. Okay, so you take immediate action and go to the hospital. And there is a chest pain, pounding pain, like a grab, and everyone knows it's a emergency situations. So today we are not discussing about those obvious things. We are discussing about not so obvious but still a deadly situation where you should rush to the emergency room. Okay, so let me give you an example here, which is a ruptured aorta. You will see that later. So this example, the person is hardly of age 40. Okay, and what he felt was a belly ache. Okay, so he felt it like it's a bad day kind of thing. It's a usual belly ache, and by the time he reached the hospital he was almost weak and pale. Okay, what that means is that situation caused bleeding, okay, into his abdomen, and the end story is unfortunately is no more. Okay, so we are talking about such things where the symptoms may appear like we don't have to be serious. It's a false alarm kind of feeling, but it is not. So let's look at the first one, which is retinal detachment. Okay, all right. Now let's take a look at this picture to know what we are talking about here. So this is what the retina, you see that here is marked here, retina, the white part, and you can see here over here it is got detached. Okay, so this is the medical condition called retinal detachment. Now let's look at the details here. Now on a regular day, one of us, on a working day or whatever, we suddenly feeling a flash of light, and our vision is also getting partly covered. Okay, so what will be our excuse? Well, it's a eye strain or a tiredness kind of thing, so it should go away naturally. All right, but the reality is it could be a retinal detachment. Okay, we'll see the symptoms further. Now everyone knows what a retina does. It receives the light through the lens and it converts light into nerve signals. Okay, and which then passes through the optic nerve and reaches the brain. All right, now what that means is if you have no retina fully functioning, you could have no vision, either fully or partially. All right, so retinal detachment causes a serious situation where that part of the retina doesn't get blood. What that means is both nutrition and oxygen. Now if you don't rush and reach the hospital and get it addressed in the emergency room, you can actually end up with permanent blindness. Okay, please note that this is not a joke. Okay, now let's look at the symptoms here. Okay, the first one we already discussed it. The second one is you would see that the symptoms getting increased and getting worsened, and there are tiny dark spots, okay, that are either moving or not, and these tiny dark spots are increasing in your field of vision. Okay, number 2, second symptom. 3, you will see a curtain kind of thing or a dark shadow kind of thing badly affecting your field of vision. And if you have these kinds of more than one multiple symptoms, please don't waste time. Okay, this is retinal detachment. Now if you see the risk groups, anyone who had injury recently in your eye can have retinal detachment, so keep an eye, watch out. If you have diabetes, you are susceptible. If you have nearsightedness, you are part of the risk group, and your age matters, and how good is your body health also matters. Okay, so that's about retinal detachment, one of the emergency where the symptoms are not that obvious. Number 2, abdominal aortic aneurysm, AAA. Alright, so what is this? So before we go into the details, let's take a look at what is an aorta. Okay, so aorta is the blood vessel or blood pipe that coming off from your heart, carrying blood as well as oxygen, and it supplies to all the organs and each and every tissue. Alright, so when we talk about abdominal aortic area, that means the stomach area where it supplies the blood. Now when this portion of the blood vessel has trouble, you are running into trouble. Okay, now let's see some details here. This part we already discussed it. Aneurysm. So what is this aneurysm? Aneurysm is simply a fact that, say this is your blood pipe, now there is a bulge here or a balloon kind of thing which is a weak spot. So what that means is over time it can rupture or it can break. Okay, and when that happens, like I mentioned here, when that happens, the blood bleed over the abdominal area. And one more thing, it doesn't occur over a day. This kind of aneurysm, it develops over time. Okay, so you have no clue that you are having a medical condition called abdominal aortic aneurysm. Okay, only when it ruptures you came to know that. You came to know in the sense you will have multiple symptoms. Okay, now one more thing you should know is that aorta is carrying 5 liters of blood pumped per minute. Okay, so a rupture means, or a break means, life-threatening situation. All right, now you will get very misleading early symptoms. That's where the dangerous thing is. All right, so be aware of these, not just you, your family, make them aware, so someone will tell you. All right, otherwise you will end up in permanent disability or even, God forbidden, death. All right, now the misleading early symptom is you will feel a back pain or a indigestion. All right, so when that happens, what happens? We think, oh, it's just a bad day. All right, now when the symptoms get escalated, all right, what happens is it gets severe. The pain gets even severe, and the pain goes down to your legs. All right, you will feel a faintness. Okay, unbalance, unexpected fatigue. Everything slowly shows up. Also you will sometimes feel a cold or numb foot. Okay, because of low blood supply to the leg. So it's pretty simple. So when some rupture happens in the blood vessel where the blood going down, obviously the blood is getting leaked out to your abdominal area. Okay, so it's that simple. So the risk factors, please don't think it only happens for aged people. It happens to young people also. And the another risk factor is anyone having high blood pressure. Please watch out, you can have this situation. And anyone having smoking habit for extended years also. Right? So the bottom line is, when you see these multiple symptoms, don't waste even a minute. Rush as soon as you can. Alright, because this is a situation of life versus death. Okay, what's happening is severe internal bleeding. Alright, let's move on. Meningitis. Alright, so let's look at the meningitis here, the third one. Now before we go there, let's look at the picture here. So this is our top part of the head, this is your hair, and down there is skull. Alright, somewhere here, and down that there are three layers, basically called the names are you see here, yeah, all these things. Alright, so the three layers, or in other words called membranes, it basically cover and protect your sensitive cerebrum. Okay, so three layers, like you can see it here, dura, arc, maya, and all that thing. We are not going with it medically here, just understand from layman's language. Alright, so three layers. Alright, now what happens with the meninges is that meningitis actually. So meninges is nothing but this portion what we just discussed. Meningitis is the infection. Okay, it could be a viral infection or a bacterial infection. We'll come to that. Now what happens is your first symptom is stiff neck. Okay, so when it comes to stiff neck, what do we think? Oh, just a bad sleeping position or a bad turn, right? And we take it that lightly. Alright, now slowly it build up the symptoms into fever, severe headache, light sensitivity, etc. So these are the symptoms of spinal and brain meningitis. So like I said, meningitis is the infection of your meninges, where your membranes, all these three layers, are getting inflated and infected also. Alright, so it's a critical situation. The system, the brain or your nervous system will send all kinds of warnings to you. Alright, now please also make a note that the bacterial infection is deadly and dangerous. Okay, urgent medical attention is required, but you have no idea whether it is viral or bacterial, so you have to go anyway. Alright, now what are the symptoms? So it started off with the neck, stiff neck, and slowly the symptoms develop and escalates. Okay, you will have like I already told you, an unusual bad ache that never occurred in your life, that kind of pain. Then you have stiff neck stiffness, where you can't even touch your chin to the chest. Then photophobia, which is like light sensitivity, fever, vomiting, confused, all that stuff. Alright, so when you have multiple symptoms like this, please be educated, please take action. Alright, and it can happen to children, young adults, anybody. Alright, so don't think it's just a one bad day where you slept in a wrong position. Alright, now you have to get to the hospital sooner than later, because if you don't do that, alright, it can lead up to long-term disability or even death. Alright, okay, let's move on to the fourth one, I guess, that is brain aneurysm. Okay, so like I mentioned here, instead of the abdomen, the aneurysm happens in the brain area, where all these the blood vessels, nerves, blood vessels, aortic, and veins and all that stuff, where the blood is carried. So here what happens is, like I mentioned before, the blood vessel is having a weak spot. Okay, it could be a bulge or a balloon where it could break, rupture anytime. Alright, now the symptom that you get when you have a brain aneurysm kind of situation where it ruptures, or whatever that thing is that you will get the worst headache of your life. Okay, it's worse than migraine. Well, we don't know, not everyone has migraine, but it's the worst headache of your life. Okay, that's the first symptom. And like I mentioned, it ruptures. Okay, so I don't want to repeat here. It's similar to AAA, where it happens in the brain area. Now So when the rupture happens, obviously the blood bleed around the brain area. It's also called hemorrhage, which is nothing but spilling of blood. Okay. Now the symptoms: severe headache, which we already discussed. Then it escalates into other symptoms, which is a thunder or explosion kind of feeling inside your head. You will have your vision affected. Okay. Stiff neck, nausea, which is a tendency to vomit, also a feeling of upset stomach, vomiting, sensitivity to light, confusion, trouble speaking, unusual sleepiness, all that stuff. Okay. Now here it's brain, so time is brain. Okay, you rush, otherwise it can lead to serious issues like disability or death. Okay. The solution to fix the brain aneurysm is surgery. Okay, let's move on. Heart attack. Okay, now we think we know everything about heart attack, right? Because there are heart attack without common symptoms also. All right, so let's look at them. We've seen in movies and we have imagination of heart attack, right? Like actor gripping to his chest due to intense pain, right? Okay, that one's part of the story, but let's look at the unusual symptoms here. So you can even have a heart attack without even having a chest pain. Can you believe it? You will not have any chest pain, but still you are under heart attack. Okay, let's look at the details here. Now, who are under the risk groups? Okay, women, all right, older adults, and number 3, people with diabetes. Okay, now these unusual signs of heart attack are easily mistaken. Okay, like and why we'll see, but and that is a dangerous step. Okay, now what are these unusual symptoms you are talking about? Now shortness of breath, okay, which will be taken lightly to some extent. Then you will have discomfort in the arm, jaw, neck, backside, your shoulders, etc. Okay, it's not a pounding pain, it's more like a tightness or pressure or some kind of achy pain, which is chronic kind of pain, which is a dull kind of pain. Okay, then you may have vomiting, nausea, which is mistaken for stomach upset. Then you will have some tiredness, and even if you take rest, you will still have tiredness. You see, these symptoms are easily can be mistaken because we get all these symptoms right in a day and we get along with it. Now, what is anything else I missed out? Yeah, faintness also there, and this in this case the faintness is followed by cold sweats. Okay, now so when you have multiple symptoms, okay, if you just have one symptom, I don't know, you may have to use your common sense, but some of even if for one of these symptoms like this, it's not to be seen as a minute one. All right, I would go. All right, whereas in the case of vomiting, well, I would see whether do I have multiple symptoms or not. Okay, so even if I have a faintness, I would see whether it's getting improved or not. But if you have multiple symptoms, then likely you have a heart attack. Okay, now I have an appeal to all the women because of their hectic day and the work as well as their responsibilities in the house, they always postpone their health. Okay, and unfortunately, if you are having this kind of medical condition and if you postpone your health symptoms, you are in trouble. Okay, so women should watch out more than men here. So what else here? Well, so if you disregard multiple symptoms, what that means is every minute you lost, you are losing oxygen to the heart muscles. Okay, so don't do that. And what are the risk factors? High blood pressure people, high cholesterol, family history of heart disease, all these are risk factors. So people having these kinds of risk factors should watch out. Your heart attack may not be coming with a heart pain. Okay, so the point is, trust your mind. Okay, moving on to the next one, I guess the last one, which is stroke. This one is very familiar to us. Well, let's look at the picture first before we go into the details. The first condition is atherosclerosis, which is building up of plaque. Okay, so you can see here the blood flow will have significant blockage. That means less blood flows. And there is one more situation that can happen, which is the plaque can break. Okay, and it can cause complete blockage also. All right, anyway, the normal blood flow is not there. The second medical condition is hemorrhage. Okay, which is we discussed in AAA. There is a weak spot in the blood vessel, in the like a bulge or a balloon, and it burst. Okay, and the blood started leaking out. The third one is ischemic, which is complete block of blood. Okay, so we are back to brain again, and anything to do with brain, well, the time is life or the time is brain. Okay, the brain can slowly, the tissues of the brain can slowly die. Okay, now if you think only older people will have strokes, that's completely false. It can happen, and it can happen to anyone. Okay, at any age. All right, now blood flow, we already discussed this part. Okay, now the medical emergency strokes. Obviously, the sooner you go, the better it is. Otherwise, there will be brain tissue damage. Okay, now when it comes to blood clot, okay, for example, the one here, ischemic, or even this one, there are medications to break up the clot. Okay, and it will restore the blood flow. All right, but you must reach the hospital in time, and this procedure needs to be done in the first 3 hours or the maximum 5 hours. Okay, if you reach there after 5 hours, there is brain tissue permanent damage. Okay, and the doctors won't use medication because applying the medication after 5 hours is a risky proposition. All right, so they won't do that. So look at the importance of time here. Let me also tell you the attitude of the public, including me, that we typically understand, we typically know the value of something only after we losing it. Okay, but I think I should keep remind me, and I think we should all keep remind us that the foundation to any success is our health. Okay, so it's very important. Now, what did I say here? Prompt treatment, of course. If you see that those people who had stroke symptoms and they reached on time in the hospital, they recovered fully and they're leading a normal life. Okay, after the stroke. So that's the beauty of reaching on time. All right, now what happens if you take a chance, you hesitate, you think it will be okay, things will get better, and you go next day completely in a very pathetic situation? Well, the result is going to be very tragic. It's going to be permanent paralysis and even brain damage that could affect any part of your thing, which is brain means what? Everything, speech, emotion, thinking, I mean so many things there. All right, so you don't want to do that. Now let's look at the symptoms. All right, just remember this word fast. F for face, A for arms, S for speech, and T for time. Okay, so face, one side will be drooping or in numb state. Arms, one arm at least will be weak or numb, and the person won't be able to raise both the arms evenly, okay, and speech, it will be distorted, and it will be difficult to understand also for others. All right, now with time means simply rush, okay. So if you have symptoms like this, you don't want to take a chance, call 112, reach the hospital in record time. All right, go fast. Now there are other symptoms also that comes with stroke: sudden vision changes, severe headache, difficulty walking, loss of coordination, all that stuff. All right, so I guess you got some idea here. Now one more thing you should do when you start to hospital is note down the time you leaving the house. They want to know that, okay. And you should always use the ambulance. Don't depend on your car or neighbor's car or anything. 112 is run by police department, and they have good system in place. All right, you will be fine. So with that we are done pretty much here. So one last point is, so anytime you are in doubt whether I should go or not, that hesitation part, right, which is actually very haunting, because many patients wait too long to get to come into the emergency room. The reason is they think it could be a false alarm, and many people don't want to go to a hospital, okay, for many reasons. But let me tell you one thing, your poor decision can cost you very badly, okay. It's important you understand the symptoms, make a note, and save your time, because saving time means saving life, okay. And one last thing which is unsure, yes, what is it? Okay, let me see. Well, it's telling us that better to be safe than sorry. That's true, very true, okay. Because many in a worst case scenario, okay, if you don't care much, you may end up with temporary disability, permanent disability, permanent loss of vision, and unfortunately, God forbidden, death. This shouldn't happen to any of you in your family, okay. Don't take a chance, apply your common sense, see there are multiple symptoms, and whatever we discussed here are very important points, so discuss with your family. All right, and your body is very, very intelligent, it tells you, okay, so please pay attention. Please don't fall to the confirmation bias, okay, that can be deadly. All right, so take help. So with that we are done here. Please read the disclaimer, okay, and thank you so much for listening, and I hope this was helpful to you, yeah, and you take good care. All the best, and please leave any comments that may be helpful to me. All right, take care, bye bye.